My name is Ben Fonseca.
Hi, I'm Aisheea Isidor.
Hi, my name is Glenn Harden.
My name is Tanya Boman.
Cheryle Bradley.
Patrick Paul.
Joseph Dulong.
I'm a chief inspector for the Orange Line.
I'm the Division Chief of Training for Operations.
I work for the MBTA as a machinist.
I'm a streetcar motor person on the Green Line,
I'm an inspector,
I'm a bus driver.
I was tested positive.
and I tested positive.
and I tested positive for COVID-19.
I had COVID.
And I had COVID.
I was diagnosed with COVID-19 in April of this year. So for me, I had loss of smell and taste. My breathing was very labored. And then with body aches and chills, on some days I could barely get out of bed.
It was coughing, but nothing was ever coming up. So it was like a dry cough.
It was something that I have never experienced before. I haven't had an asthma attack in 20 years or more, and it kicked up with my asthma.
My body aches were tremendous. It moved from the top of my neck down my back, then moved over towards my side, and that had went away. But while I was experiencing that, I was experiencing some headaches as well, and also light dizziness at the time.
Once we started with the mask policy, or it was given by the governor, I wore my mask faithfully. So I still can't trace back to where I got it from.
No, I was not a regular mask wearer before.
In March, no one was wearing masks.
When I'd walk like 5 feet and then I'd have to stop to catch my breath. That's when I knew something was definitely wrong.
I called my doctor. My doctor had me go to the hospital, but because it was early, this was March 30th, I wasn't a healthcare worker. I wasn't considered essential enough, even though I told them I worked for the MBTA and that I drove a bus. They did not test me and said, "You probably have it, go home." And within 2 days, I was in bed, not able to move, not able to eat anything, not able to drink anything, and was in a lot of pain. So I spent the whole month of April out of work.
I called up my primary care who connects me to COVID. I can't talk to my doctor at that time. And they said that I'm talking in full sentences that I didn't need to be tested. And I said, look, I'm not gonna die in my room. I wanna be tested. I don't feel good. I'm not breathing right. So the next day I just put my mask on, I get up and I went. I was delirious. By the time I got to the lobby, I think I passed out. I don't remember much after that. They took me in an ambulance to the hospital and I was there. And I just remember people rushing around. I had IVs in both arms. After 5 days, they said, "It's gonna get really bad up here. Would you like to go home?" And I said, "Yes, I'll go home." They said, "You're not out of water. You're not out of hot water. You can go home, but you have to quarantine in your room." So
When I was in the hospital, I had no visitors. I felt isolated. And then to hear the news of, fellow coworkers getting it and, one passing away really made me even more scared.
This is not something that anyone wants to experience. I was lucky this time. And I'd wear a mask, I'd wash my hands, I'd do whatever the CDC tells me to do.
Wearing a face mask, even if you don't feel as if it's a necessity for you to do because you're a healthy person, you may become asymptomatic, you may get infected and now affect people that you are now hanging around with. And unfortunately, I could never deal with that kind of guilt.
This threat is real. This is not a joke. Please, everybody be safe out there and wear your mask. It's not a joke.
Hello, I'm Ronald Ester, Chief Safety Officer at the MBTA. More than 200 MBTA employees have tested positive for COVID-19 since March. You've just saw the faces of a few of your colleagues who are joining us today to share their personal experience in having tested positive, gotten sick, and recovered from COVID-19. Last April, we were joined by Dr. Jha, formerly with the Harvard T.H. Chan School of Public Health and currently Dean of the School of Public Health for Brown University. Dr. Jha has agreed to join us again today from the front lines of the pandemic to provide the latest on how to protect yourself and those around you as we approach another spike. Thank you, Dr. Jha, and welcome back. General Manager Steve Poptak sends his best.
Thank you for having me back. I'm really happy to be here.
First, can we discuss the threat of people becoming complacent, especially as winter approaches and people are spending more time indoors?
Absolutely. You know, this has been already a long pandemic. We've been all dealing with this for almost 9 months now. But it's a serious pandemic. 220,000 people in America have died. Nearly 10,000 of our fellow citizens of the Commonwealth of Massachusetts have died. So I get that people are tired, but we have a tough winter in front of us, and we've got to not get complacent, and we've got to act. And we've got to act to keep the virus levels low in our community.
I know we can't say this enough, but remind our employees of the importance of wearing face coverings, washing their hands, and practicing social distancing.
Yeah, you know, I get that people are getting tired of this pandemic, but if we want to get through this time period without a lot more people getting very sick and a lot more people dying, there are 3 key things everybody needs to be doing. People need to be wearing a mask. It's probably the single most important thing you can do. If everybody wore masks, it would make a big difference. Hand washing, soap and water, hand sanitizer, whatever you have access to, also absolutely critical. And then maintaining that social distance, trying to maintain a good 6 feet, ideally a little bit more if you can. All 3 of those combined together, if all of us did it on an ongoing basis, it would make a big difference in reducing the virus in our community and keeping everybody safe and letting people get to work and get to school safely.
Finally, there are instances in the media and on the internet when COVID-19 is not portrayed as a serious threat or that wearing a mask is not necessary. Some MBTA employees have said they don't believe in wearing a mask. Can you debunk this misunderstanding?
Yeah, you know, there's been a lot of misinformation in this pandemic, but if you talk to frontline doctors and nurses, people who are taking care of people who are getting sick, I think we're all going to tell you the same thing. The evidence here is very clear. Masks work. I wear a mask every time I leave my home or I'm not in my office. It's absolutely critical. And we know this is a serious disease. We know it's a serious disease because 10,000 people in our Commonwealth have died from this, and hundreds of thousands have gotten infected here and millions across the country. So unfortunately, that misinformation can be confusing, but if you listen to the doctors and the nurses and the public health experts, they'll all tell you the same thing. Take it seriously, wear a mask, social distance, wash your hands, make a big difference in getting through this time period.
Thank you, Dr. Jha, for joining us today and sharing your thoughts with us.
Thank you so much for having me. I really enjoyed being back.
The Safety Department continues to conduct face covering audits throughout the system. We're seeing high levels of compliance, but there are too many instances of non-compliance. We need to do better. Currently, there are only 7 employee exemptions to this requirement. As Dr. Jha explained and your colleagues described in a real-life detail, COVID-19 is serious, and we all need to do our part to prevent the further spread of the disease to coworkers, our families, and our customers. After hearing from many of your coworkers, I hope those of you that have resisted complying with the face covering policy will now do so. COVID does not just affect you, but those around you as well. Thank you for watching.